Yep.
I wouldn't say that people know, but they're allowed to know. They can know. We can tell
It's
them.
knowable.
Yeah.
That was influencing my.
Yep. Good. Good afternoon, everyone. I'd like to call the, I've forgotten the date, February 13th Finance Committee meeting to order. Thank you all for being here. As a reminder, it is being recorded and live broadcast. May I get an approval of the agenda, please?
Motion to approve the agenda.
Second.
All in favor?
Aye.
Aye, thank you. I will open the floor for public comment and close the floor for public comment. So let me tell you what's going to be on the agenda today briefly. First, we're going to go through real estate quickly with Ken Bogrand. Then we have the Contract Review Committee is going to be doing their presentation. They were scheduled for today. And then after that, we will be talking about the Act Now article on transportation. So just to give everyone an understanding of what's going to happen when. So Ken, if you would please join us at the table and speak in a microphone down by Chris Glowacki. Thank you for being here today. So all of you have gotten the input from Ken already that was sent around a few days ago. I have a couple questions that Joe Grouse sent me, which I will ask you.
Okay.
And then if you would just take us through each article, Ken, and then we can go from there. But
What I did was went through each of the articles, and as you can see in the report, what I tried to do was to explain the nature of the request from the person who was submitting it, and then some sense of what they were trying to do, and then made a recommendation with respect to a suggestion as to what we should consider in terms of the motion from the FinCom. So the first one is a small parcel on East Hollowell Lane. 105, it's Article 105, and with respect to the location of the property, this stub here on the property. The sound is out here, and the water is coming in here, and part of this lot is already starting to erode into the water. So there is not a problem with respect to access if this is taken away, because all the other lots around there do have access, and the property would be paid for by the people in parcels 7 and 9. So,
okay.
This seems to be, it makes sense from the town's point of view, and what we would recommend is that the abutter obviously pay any cost of the survey that might require it and any costs of town council with respect to it. This is registered land, so it's fairly straightforward in terms of being able to move forward.
What's the difference between registered and recorded?
Okay, registered land is land that is with the land court, and so the title to registered land is not challengeable because of the fact that you go through really an entire process to make the determination as to the nature of the title, and whatever it says on the certificate of title means that that's the definitive nature with respect to the land. So it can't be acquired by adverse possession or anything like that. The recorded land is land that is just recorded in the registry of deeds, and there's always a history with respect to it that has to be looked at when you're doing a title search as to that particular property to make sure that there isn't anything in the history that could affect the title to the property.
So basically registered is better.
It is, from a point of view of definitively knowing what you have, registered land is the strongest title that you can have.
Okay, thank you. That was one of Joe's questions.
Yeah. So that is with respect to the property at East Hollowell Lane. The next parcel is, the next parcel is, you needed to take a look at two of the maps that I included, because it is a parcel that comes in from, Lindbergh Avenue to the edge of Lot 9, right? It is nothing exists there except truly something on paper. And There's an error in the warrant article with respect to the amount of land that needs to be corrected. The amount that should be in the article is a combination of 2,146 square feet plus 536 square feet in order to be able to make sure that the correct amount is involved in the warrant article. When we've taken a look at this, there does not appear to be any public interest in maintaining this portion of the street because the abutter has access off of Clifton Street, and the abutter on the other side has access off of Coffin Street.
Okay.
So, again, the recommendation is to approve the taking and the disposition, again, similarly with the abutter paying the cost of any survey and the cost of town council.
Okay, thank you.
The next one is the one that is the most complicated in respect to this. And this is Cherry Street in Surfside, Folger Avenue, right? The issue here is the ability to have emergency access out of this area, which doesn't exist right now except through Blueberry Drive. So the planning board has always insisted that there be other emergency access, and that was what was supposed to happen here, but it didn't happen at the time that this was created. So the road, Cherry Street, does exist from Field Avenue over to Folger, and what needs to be done is from Folger Avenue over out needs to be created as emergency access. Emergency access does not have to be the full 40 feet. Okay. It could be 20 feet wide. So the recommendation would be that whatever we do in terms of the disposition, that there's required easement given to the town for emergency access of at least 20 feet wide from Folger out onto the other street.
Is it drivable now, or is it?
No, it's
covered?
walkable now.
Okay.
It's a walking path through there right now, but you need to. So it's not a lot of work to be able to open it up. You wouldn't pave it. You'd probably have a different surface to go through, so that a vehicle could go through. But you'd want to be able to have the ability of a vehicle to go through on the 20 feet part of it. So.
And who would be responsible for getting it
The-
in that shape?
The thing is that the town would have to be responsible for getting that into shape, but the abutter would have to pay for the survey and the other legal costs, so.
Okay. Thank you.
Then the next item was,
North Carolina Avenue.
and this one was really hard to figure out. North Carolina Avenue is a non-existent street, but it's a paper road. And on North Carolina, I'm not sure if it showed up on the material you sent, we sent to you, is that there are a number of lots in here that are owned by the town, which are lots 49, 48, 47, 46. And then there are lots on the other side of North Carolina, which are in parcel 142. So there are lots that the town owns in parcels 142 and 143. So the recommendation is to be able to deal with that, but to create an easement to the town to be able to have access to the lots in section 142 and 143 along this strip of red line that is outlined here. So our easement would be on here. That would provide us access to this and to this. And it shows up, it comes out in here on Starbuck Road in terms of understanding where it is out in Nantucket.
Okay.
So, and that makes sense in the sense that A, it provides value to the town, but B, it also preserves our access to this particular property so that it becomes an asset that the town could at some point in time dispose of because you'd have access to it.
Okay.
And then the last one was with respect to Morgan Square, and we recommended that it not be proceeded at this point in time because it didn't have the second half of the article, which was the companion article of disposition. So that could be addressed at the time in the fall when we have a town meeting in the fall. and that would be the proper time in order to be able to do that, so.
Thank you. One other question on, sorry, looking here. On 109 and 110 Cherry Street, Surfside?
Yeah,
Is the abutter happy about the easement? Are they willing to comply with the easement?
we have not spoken to him about that, so at this point in time, my role was to just sort of figure out what it was to do.
Okay.
Recommend what we should be doing, assuming that that's something that we want to do with going forward, then the next steps would be to talk to the abutters and try to figure out a way to be able to do it.
Okay. So my question is, if we proceeded with this as recommended, and then the abutter said, no, I'm not going to do that, then the deal stops?
Well, no, then you can take it by eminent domain.
Oh, right.
Yeah, right. We want to avoid that, but
Sure, of
in fact
course.
of the matter is that we have the absolute right to do it because of the fact that it is critical for emergency access out of this subdivision, and emergency access should have been provided, and this is a way to be able to do it now. And that was the area actually where it was planned originally. So.
Okay, thank you. Other questions for Ken? No other questions. Thank you, Ken.
Okay, thank you.
Good. I'm looking for Dorothy. There she is. Ms. Hertz, please join us at the microphone. Yes, please, and you have to move far away. Yes, there is now. A new one. I'm just, you can, that table.
far away?
Texas.
Sorry, what number? Peter?
I'm not sure if you know everyone on the
I think it's
FinCom.
9.
I know some of the board members.
So if everybody would like to introduce themselves to Dorothy and to Taylor, please. George, starting with you. He's new to show. You know me.
I know you.
Hello, Peter Schaefer.
Hi, Peter. Jill Beath. Hi, Jill. Joanne. Hi, Dorothy. Hi, Dorothy.
Hi, I'm TR, I'm the new Human Services
Nice to
Director.
meet you.
Nice to meet you all.
Welcome.
Thank you.
Thank you, Dorothy. Over to you.
Thank you. We're gonna actually do a little a summary of each one of the organizations, and what we see that they've accomplished this year, what their hopes are for the upcoming year, and then give you our recommendations as each one goes along. It should be stated that we do not have a report done because we just finished our deliberations, but we will get you the report as soon as possible. I have provided Brian with the breakdown on the allocation, or what our recommendations are.
Thank you.
Okay, so we're going to start with a safe place, which is, and if I say anybody's name wrong that's in the room, I apologize. Jen Frazee. Over the last couple years, the town grant has helped support the outreach and prevention program, as many grants are restricted for in-house services that the Safe Place applies for. One of the programs they provide is called SAFE, which they do in collaboration with Health Imperatives, and more recently they're collaborating with the Boys and Girls Club on this program, which is offered during teen night. This program encourages prevention through healthy relationships, understanding healthy behaviors, teaching and understanding of communicating when a situation is not feeling correct for a child involved. This allows them to know that there are resources available to both them and to their peers. Through an educational program, they're able to reach out to people that they see maybe in conflict and tell them there's somebody out there that's willing to help you. They also do a collaboration with the Nantucket Public Schools, where they offer a program to 9th and 10th graders 2 days during the health segment that deal with unhealthy situations and, you know, their sexual rights. And they offer a 2-week program to the high school students. It's available in the fall, November, and in the spring. And during that program, they teach the students about healthy relationships, sexual consent, assault, and how to handle sexual assault as it is becoming very prevalent on school campuses. And this is provided so as kids are preparing to leave for college. They also offer professional training in youth prevention to the EMS and the police, as well as the sexual assault nurses at the school. And these are, if I say it right, there are CEU credits. They get 4 credits for participating in this program. The police program was a mandatory program, so all the police in the crisis program worked with them. Their Children to Witness Violence program has been seeing a real increase. And this January, 23 children have already utilized the program. This is a free therapeutic program. And they also offer not only individual, but they offer a program where they do sports, integration through sports therapy. It's also has been extending and I should note that all the services that the Safe Place offer are free to community members. The therapeutic programs, everything is free to the members. They've been extending their hours with hopes to expand and continue to improve their programs over the next year. The CRC they made a request for $55,000. This is the first time. Well, they actually made a request last year for $55,000, but over a period of 10 years, that was their first increase. They did not get awarded last year. This year, we are recommending the awarding of $55,000 to this program. Small Friends, which is the largest child care facility on the island, it has 69 children from very diverse demographic areas enrolled in the program, with 140 children on their waiting list. The program that the town funds is the Extended Day and Snack Program. This Extended Day program allows parents to complete their work days and with confidence that the children are a safe and certified facility with early childhood development teachers on staff. The hours of operations also allow parents to actually complete a full workday. The snack program provides young children with healthy, nutritious meals and introduces them to healthy eating habits, which they take back to their home life, and studies can prove that. We find that this is an essential service to families, and that the nutrition program can only help also offset some of the programs that are in the community that are working with children in nutrition and obesity, since the state of Massachusetts has the highest rate of obesity in the nation. They asked for $15,000. We are recommending, the CRC is making the recommendation of the $15,000 for that program. A new program that came to us this year is through the Artists Association. It is being started by Courtney Bridges and Maggie Murray. And this is a request for a therapeutic art program. The program will run, it is running at the moment at a very small scale. And their hopes are, with the grant, to expand the services to not only young people, to everybody in the community. It's designed to increase the overall health of the island and decrease the pressure on other organizations that shoulder the mental health issues that we see in this community. The program is designed with initiative through the Mass Cultural Initiative, I think that's what it's called. Am I correct?
Massachusetts Cultural Council.
Thank you.
Just stop you 1 second, sorry.
Mhm.
I'm on the board of the meeting, I didn't know that.
Okay, then you need to recuse yourself.
Yeah.
Thank you, Jill.
Sorry about that.
You can sit next to Chris.
The teachers get formal training on how to implement this idea of the program. And many studies are evidence-based, that show that therapeutic care through the arts, the visual and creative arts, helps relieve stress. It helps open expression, and sometimes expression through arts can be one of the most therapeutic things available in a large-scale environment. Correct?
Absolutely.
I have to verify that over here.
Social worker says yes.
And their hope is that it will become a commonplace within the community, and that through more access in the community, it'll lessen the cost. They've asked us for initial cost of $18,200 to initiate this program, and we have made the recommendation for the $18,200 in the program. The next one is Health Imperatives. This grant helps subsidize the salary and cost of running health imperatives on the island. And there's been a tremendous effort through the health imperatives to start integrating their services through much better conversation. They offer WIC, they offer a kiosk for snack, they do CACs, The month of January, they saw an increase from last year. They saw 77 clients. This year, in the same clinical hours, they saw 97 clients. So they are expanding. They're one of the programs that we see probably the most growth in. And almost every year for the last 5 years, we've seen tremendous growth in their programs. And they look at the needs in the community and they try to expand upon those needs. And I will say they are doing it out of one of the smallest facilities I have ever seen. And yet what happens is they are so invested, everybody is so invested in that program, they give 100% in making that program work, and they make 100% in making that program expand. And if you could get a quarter of that enthusiasm into every program running on this island, it would be absolutely unbelievable, because they are an unbelievable organization. They've started parenting classes through the community school, which the community school has actually asked them to increase because they've had such a high demand. They've done a nutrition program with the hospital, both in Spanish and English, and those programs are helping fight the obesity and proper nutrition for some that's not common. They started a program called FLAG. It's PFLAG. It is a support group for the LGBTQ community. They had their first group seminar with one of the founding members of FLAG at the Athenaeum a couple of weeks ago. They had 60 families participate in this. They said they had one heckler, but 60 families, and that is a massive amount. And they are working for their first group to work with children on the island that are in this community. They do a collaboration with the Safe Place with the Safe program, which also promotes all the same things that we talked about before, and they do this in collaboration also with the Boys and Girls Club. They have run a program for the Nantucket New School and are running and accessing programs in the high school. What we found very interesting is a lot of pilot programs that start on Nantucket, they've actually, because of their success, been able to take them and make them broader within the community they service, which is basically south of Boston. And then by doing that, they're able to get more funding for this program. What they have asked for is, and one of the biggest things is, health imperatives is becoming a common name within this community. And it's outreaching to people in the community that don't necessarily get these services, because they take care of the underinsured, the uninsured, and some of the insured. And so within the community of this, our diverse cultural community, they're being highly respected and looked upon because they trust the people within that program. And we think it's become very viable and very important for our island community. They have requested $75,000 from the town of Nantucket. We are making the recommendation of the $75,000 for their program. Nantucket Cottage Hospital Social Service Department is actually a double application. It is for not only their social service department, but it is also encompassing their ambulatory service. The Cottage Hospital continues to redevelop their social service department under new leadership, and they are trying to diversify through reaching out to other parts of the hospital to maybe for better resources, to look at where they can reach out in the community for some of the people that are coming in to utilize their services. Their hopes are to establish a community webpage in the near future to make these resources more readily available to the island community that are out there. Their social worker is now participating in some ongoing educational classes to hope to enhance their job and what they can provide to the community at large. They have, in the last year, they have a CAC, the availability to CACs, which used to be called healthcare advocates. They are now community certified application counselors,
Yes.
certified application counselors. And in doing that, that's actually done through the finance department at the hospital, and what we found out, it is a mandated service. Once you do that, it is mandated that you provide this service to the community. But in saying that, they did last year help 250 seniors with the Medicare Part D program and enrolled 540 into the Mass Health. And they're trying to find ways to work to teach the community how to use social media or computers, and they're hoping to get a kiosk system in at the hospital in hopes to make that a more viable and accessible program to them.
Dorothy, is there an automatic referral to these counselors if you come to the hospital and you're not insured?
If I am correct, yes, they are. Okay. Because in doing so, no matter what, Health Imperatives has one on staff too. Okay. And is more than willing to expand that. They last month saw 20 clients themselves at Health Imperatives, with a part-time clinician doing it, or part-time CAC person doing it. I think that the hospital now knows that there are more people available, and I also think that through a little bit of research this year, found out that the CACs are actually it's a mandated thing through the state, which I don't think they understood that prior to this year's grant process.
The hospital didn't.
The hospital did not. They were, or the social service department at the time. I believe it became more readily available. So they're continuing to strive a little bit better and working with the community. We did get an original application, and through a little bit of work on parts of a few of our CRC members were able to get a more focused package from them. And the other thing that we're making they're asking for we're sort of subsidizing looking at two different things within this grant. The other is the ambulatory service that the hospital provides, which provides transportation. Last year provided transportation for 36 patients to behavioral health clinics throughout the Commonwealth. They're constantly continuing to work with insurance companies to find ways to get refund or reimbursements through it. It is not an easy thing because of the time on the boat is not insurable time. So they're working on that.
That's the same program that was Article 34.
Right, the Walter Wieners.
Right.
Yes.
Correct.
Yeah, so it's rolled into this.
It's been
Correct.
rolled into this
And what's the amount of the ask?
from
The hospital.
the total hospital.
No, specific to the ambulatory service was
Right.
110,000.
110 for the ambulance.
So that was rolled into all of the CRC requests.
Correct.
Correct.
And what's the amount for the other part of the hospital request?
The other amount for the hospital is
101,123.33.
Thank you very much. You're very good. That's why Stephen's on our board. One of the things that came up and what we put on the table in helping them, and it should be, it is very important. This has actually helped patients get to behavioral health clinics and resident programs they needed to get into.
Right, sure.
But one of the things that we asked and we put on the table and they were very open to was we suggested we start a roundtable conversation on how to get the players involved, and so that we can make this a more sustainable entity within the community, where they can find the proper funding and get all the parties that this really affects involved. And they are really open to doing that and wanting to do that. So we're looking forward to starting and initiating that once town meeting is over.
Mm-hmm.
That's one of our goals.
And this is this request was offset by the money that came from Sandbar. Yes,
Last year.
but also
No,
this
not
year.
last year. No, it did not.
No, not the ambulance, the a safe place last year.
Last year.
Right. It was Safe Place last year. Is not the hospital or ambulance this
No,
year. It
it
was
is not.
Okay. I just wasn't sure.
Yeah,
What it was.
Safe Place
It was
last year, but
ASAP,
against the
correct,
CRC grants, yes.
This is a different, yeah, this is different. So, with that being said, they made a request for, well, they changed their request, I'm sorry. That's why I brought this other page.
The current request.
The current request was for $211,123.33.
I got you, Dorothy.
Thank you very much.
Thank you, Mr. Secretary.
It's very good. With 110,000 being that, 123.33 for the social service we are making, and the recommendation for 211,123.33 to the Nantucket Cottage Hospital. for
Right,
those
so,
two
so
programs.
fully funded their amended request.
We did fully fund their amended request.
Save everybody the math.
What?
He saved us.
Yeah.
Oh.
Yeah.
So Fair Winds is the community's only nonprofit mental health care provider. And through the grant, through Nantucket, it allows for sliding fees for island residents and helps a portion of the walk-in urgent care program. January, Fair Winds saw a major challenge as they lost 4 clinicians. 3 full-time and 1 part-time clinician left their program.
One of those was me, who was very part-time.
And one of the things that in talking to them that they emphasized they were very proud of was within that period of time, even though they lost the clinicians, they really worked hard to get the patients that were patients with the most severe needs in to see somebody within that period of time. And at this point in time, they have 10 people on a waiting list, which are children who their priorities, their needs are not a top priority. And so as they can get clinicians, they are going to be filling those people back into full-time slots.
Have they replaced the?
They have replaced only one, a Department of Health clinician came on.
Bilingual.
But he's trilingual.
Oh.
Sorry,
Yeah.
trilingual, and has many years of service, and so they're really excited. They are still actively pursuing the other clinicians.
And was there a specific? Was it housing?
It was not housing, but it was. They did lose everybody within 1 week.
Wow.
Wow, it's a perfect storm.
Yes, it was a real perfect storm. So
Did they go to other jobs on island? Well,
2 of
Taylor,
them-
One
obviously
of
you
them
did.
actually replaced me at OIH, so we're
Okay.
trying for
Yeah.
that too, I guess.
You have to do both.
It's not-
It's
One
a
went-
domino effect.
one went into private care.
Okay.
But I can't
Okay,
address why the others left.
okay, thank
the
you.
program. So Fairwinds has continually trying to work with Gosnold, the hospital, the police department, the primary care physicians, and with Addiction Solutions. They're actually starting a group session with Addiction Solutions who their clients need group therapy programs. They offer a lot of programs to the school too and support through our school system. We have seen them continuing to try to improve what the services they're giving. One of our concerns always is the expansion of services when you're not able to actually just take care of the basic service you need. And that is where we would really like to see them emphasize more on their basic services. Providing good, healthy, basic services with strong management can really make a big difference in how a program, works. You don't have to have a lot of tentacles, just one really good one can make a big difference. They are hoping in this next year to become what's called a certified community healthcare clinic. This will allow them to expand their services. And they're doing this, they're in the process of applying for what is called an expansion grant. And they'll do that in March. If this happens, what will allow them is to do these more services, some of them even with clinicians that can give more certified psychiatry help to do prescription drugs which need to be done. They are trying to work with primary care physicians at this point to make them feel more at ease about filling out or continuing after psychiatric care has been given, the medication, if a patient is stable, which is something some of the primary care physicians have a difficulty taking on. The thing is that in order to become one of these clinics, the state has to be certified, and at the moment, the federal government has not given this to the state of Massachusetts. They've only given it to 9 states within the country. So they're hoping that in the next round of negotiations, this might happen. That is a program that won't come into play till 2021 or 2022. So we are, as we know that since mental health is such a dire need for this community, they did ask us for $242,000. We did not make a recommendation for the full amount, because we did notice last year, even with that recommendation, when it came down to the end, they were able to get a majority of their funding. At this time, whether they will be doing mentoring youth as a program or whether it will be leaving them is still on the table. So with that being said, the recommendation from the CRC is for $116,397.87. Any other questions?
We never had sense when I was on this committee, by the way.
So the hospital's amended request came down to 33 cents.
And that's why we
there
had
was
to get
another
into-
request that has 80 cents in it. So we
Just
ended
saying,
up where we
we
ended
didn't
up.
need
need
sense when I was on the
13
CRC.
cents.
when I was on the
Try.
If anybody
CRC.
wants to round it up, I'm sure they'll take it.
I think everybody will take it. So South Coast Legal Services offers free legal services to the island residents with that fit within the financial need. Those they provide family law, immigration law, and help resolve landlord-tenant issues. They have family law, their immigration program. They have somebody that comes over, and every time somebody comes over, they are bilingual attorneys that come to the island if the needs are needed. They do a rotation basis. They go between the Safe Place, the courthouse, and the Elder Center, or Saltmarsh Center, I should say, sorry, where they provide it. The average client takes 4 hours. They closed 14 cases last year. They have 21 cases right now. At an average cost of $225, the low end of an attorney, they ask us for $4,500, which actually covers their travel expenses to the island. When we break it down, if we look at what the services are providing in the 14 cases that were closed, it was basically we were paying $57 an hour for legal fees for residents, a lot of them being seniors. Looking at it was seniors or immigration that we were dealing with. With that being said, we think it's one of the best buys for our buck for the island, and at $4,500, the CRC endorses funding that. Cape Mediation is also available in the small claims and district court. These mediation services help both parties in disputes find an acceptable resolution. And by offering this service, it frees up the courts to take care of some of the more important services that they have to take care of in the district court, and lowers the cost of running our courthouses to each community. And because always a resolution that is found between 2 individuals and the law doesn't come in, it makes for a better working community as they go out, and especially here where you're constantly working with these people. So we think it's a very viable service to the island. It is done by total volunteers. So what we are paying for is actually, or what they've asked us for, is actually their transportation costs to the island, what it costs them to come to the island. And Cape Mediation is asking us for $2,578.80, and we are making a recommendation for the $2,578.80. Elder Services of Cape Cod is the Meals on Wheels program. One of the most essential programs that we see on the island, as a lot of these services really aren't really geared for the elderly that we support, but this is one of the most important. It services 74 of our island seniors, and it's made possible through the essential use of volunteers. And those volunteers will go in with their meals, And they do the social and welfare checks of everybody that comes into these programs.
That's often the only face-to-face in the day. For
Yeah,
a lot of those recipients.
for a lot of them, and in a week, they don't see people. And what it allows is when you're done with the program, you have to do a check-in. And when they do the check-in, if, somebody says to Sherry Hunt, we see that there's something, askew here, she does a check herself. And if services are needed, she makes sure those services are provided. And, it allows, it is such a respected part of our community, and they are respected for what they do, and the people trust Sherry. So it opens up such a great avenue of communication between the two. This program is going to be going up for bid this year. It is being held by John Keene at Kitty Murtaugh's right now. It will go up to bid in April, with the final awarding of the bid in October. And the monies that they ask for us covers less than 17% of the cost of running the program to the island, which is really nothing for what the benefits are to our island community.
In prior years, have we gotten more than one bid?
They have not gotten any more than one bid in many years. Many years. They're not sure that they will be getting it. And the only reason they did increase their request because the cost of running a meal is $12 and I think 72 cents a meal. So Elder Services has requested $20,000, and we make a recommendation for the funding of the $20,000 for that program. The Interfaith Council consists of the rental assistance program, the fuel program, and the food pantry program. This program over the last year helps to keep families who struggle not only because of their income bracket, maybe because of their age, the elderly, for health reasons. It helps provide financial assistance in keeping them in their homes. Some of their clients over the last few years have increased as far as people with health issues, where they are supplying longer term rentals for them, rental available to them. The biggest problem they see is they get a lot of phone calls for people asking them if they can help them find housing, which is not there. But one of the things this program does do is in supporting rental assistance, they also make sure that the homes that people are in have, they're certified. The Board of Health, they would pass any health inspection, any building inspection, so that people are in healthy situations that they're in. And what they're seeing is that the affordable housing is becoming a severe burden for senior citizens here, because there is no, they lock into something, as Janice said to me, they might lock into something when they're in their early 60s and 70s. They don't have that kind of rental income coming in. So, they're finding it really tough to make ends meet and stay in a home. They're continuing to work with the Landmark House, Academy Hill, and now the Richmond Group in helping in some of these financially assisted programs, state or locally funded programs. The food pantry works diligently with resources such as the Boston Food Pantry, which they go to Harwich and bring over fresh food and vegetables to our community. They saw 216 clients this year. They have 700 unique families, I should say. They have 766 unique families registered at the food pantry this year. They have expanded their services this year, which we are pleased to see that they are making deliveries to the Academy Hill and Landmark, and also finding homeless people and making sure that they're getting food. They have done a major collaboration with the local farms, who bring them some leftover fruits and vegetables, and Cumberland Farms, Stop and Shop. And at the end of the year, restaurants will bring in any foods that they can give out and be used. So they're trying to collaborate. They also did a rental program where let's say the Pocomo Association might have 5 houses that do turnovers, and there's a place to drop food, and the food is then brought to the food pantry. So they're working hard to find different ways to offset the costs of running the food pantry. Their biggest stumbling block is their size. They have opened up for 3 days a week now, but what they find is, they have a very small space to provide a very big program, but they're very grateful because the space is given to them. And then the fuel assistance program, this year has helped 40 individuals in the community heat their house. They are very thankful to the INM, who has done a public outreach program free of cost, where it's being published every week in the paper that fuel assistance is available in the community. I think we've been very lucky because we've had a very warm winter, and that's been, to our benefit. Only that way, I said. Only that way, Steve. And they've been involved in a collaboration right now for short-term assistance in emergency housing for families that might be displaced due to floods, fires, or some kind of situation. So they now have an emergency funding, which is available for 2 to 3 days. They have asked us for $75,000, and we are making a recommendation of $70,000. The next one is the Martha's Vineyard Community Service, which is Kathy Hackett. It's a community-based advocacy program that serves the needs of families with children that have special needs. These services work through many different outlets in the community, and she provides not only she goes with people to medical treatments, to testing. She becomes advocates in their school district. She becomes advocates in their after-school programs. And she helps parents navigate through a very complicated system when they're in themselves, dealing with a lot of stress and trying to figure it all out. She's constantly finding ways to expand and enhance her program, and she does it through what we call a Hawkeye. She sort of looks out and says, how can I make a program better that not only helps the children in my program, but the whole community at large? And she's offered, or the program has offered a lot of teaching times to teachers, and this year she's hoping to reach out to TAs, because she feels TAs are the boots on the ground that actually see what's going on and can look at relationships and help them find ways to foster better relationships so children with special needs become more a part of the community which they live in. She's offering a program called KITS, which is Kids Included Together. It's a nationally renowned members. Kat King is her name, and she's actually, her great-great-great-grandparents are from Nantucket. And she has come back a couple times, and she is coming this year to make this program. It's a customized coaching for integration of children with special needs into programs, and it actually helps different, they've worked with, in previous years, Strong Wings, the Boys and Girls Club, the community school. They try to get, professionals to understand the importance of integration of these special needs students and support them in ways so they know how to do it. She's really, really excited about it. She finds her biggest hurdle in our community is the fact that she can't be in a space machine to get here when everything is going on. If they could, she would love to be a time traveler and go back and forth. When we see somebody come in to see us, I can tell you I have never in my life met a woman like Kathy Hackett. She brings to that program something nobody else brings. Inside of that program is that program because of that woman. It is the blood that makes her work every day. She comes in with a smile and she looks at you and she can find nothing wrong with what she's doing, only the very best. And every time comes in and says, look, we can do this and we can do that, and we're gonna do this and we're gonna do that. And sometimes she drives people crazy by it, but it is actually the blood that makes her work. And I think that this is the one program where I tell you we are so very, very blessed to have somebody that cares this much about these children and the families, because when she takes you on, and she might be servicing 14 families now, I know people in their 40s who, you know, that were children of hers when she first started here, who still reach out to her for help. And if everybody that did this could do it like Kathy Hackett, what a wonderful world we would live in. Just an unbelievable world. So it is called the Martha's Vineyard. Okay, and people have a problem, but it is a program. It's only because they're housed in Martha's Vineyard. They're asking for $18,000, and the CRC makes the recommendation for the $18,000 for that. The next one is ASAP. And ASAP, as everybody knows, is the island's prevention and outreach program for substance abuse, who also tries to educate that there is a prevalent correlation with mental health in substance abuse. They have been offering family programs for the last, I think it's now 3 years, with over 100 families to date that have participated in this program. They have gone this year to offering it in both English and Spanish, and they offer it to, you know, a 2-night program. It's a night and day program to families, and the woman that offers it, who presents it, has struggled with addiction on all scopes. And not only has she run a program, but she's suffered through addiction herself. And it becomes a really great tool for families when you can relate to somebody that not only is overseeing a program, but understands the depth of what it means to be in addictive and have addictions. They constantly work to try to collaborate with everybody and anybody. Any program they initiate, they try to collaborate with, whether it's with the police department, the Boys and Girls Club, Fairwinds, Gosnold. Their program is just an outreach program, so bringing more people in helps them. They sponsored, and they also work with the Athenaeum. They sponsored an event last night, which I believe the speaker that spoke last night is also worked with the hospital today.
Correct.
Right?
Yeah.
They would like to expand their outreach program. One of the things we find is it is not a glorified program. When you say you're talking about outreach program for addiction, you cannot get the funding that some of these other programs can get. You can't do a fundraiser, because most fundraisers in this island, you get your money because of the liquor that's given there. No program that's trying to teach children about prevention or a community can do it based around alcohol events. So they find it's a major stumbling stool for them, because it's very hard to get the support. You know, we all say we want to. I would love to see this community sort of step up to the bat a little bit more. And I mean the community, not the town, the community, to support them more readily and try to help them find funding for their program, because it is really, really a difficult thing to get funding for. And I think it's essential. I can tell you it's an essential thing. And one of the things that might not make people very happy right now is, I'm going to say that I am appalled by the lack of help the school system has given to this program to get involved in it, where they have offered and had programs available, where they've gone to conferences, they've had educational programs that they could put in, and they hit roadblocks every time they try to get into the school, and especially into our high school setting. And I think that we as a community need to find a way to get our school system to accept and work with this program, with these individuals in this program. They have a wealth of information, they can bring a wealth of information, and we need to do something to save our kids. And we have to step up to the bat and take that responsibility. So that is, you know, I am saying that myself. I am not saying that on behalf of the CRC. I should make that a clear statement. But it is very disturbing for me as I watch this and understand the struggles a family goes through. And if we can save one child's life, we've made a hell of a difference. So With that being said, ASAP has asked us for $44,200 to run their year program. We happily endorse the spending of that money. And I think that's it. So our recommendations to date are, we had a total of $913,404.80 in recommendations, initial requests this year. We are making a recommendation for $650,000 to be awarded in grants to these human service providers. Any questions?
Any questions for Dorothy? Stephen, do you want to add anything?
I think it's your best presentation yet, and that says a lot because your presentation is
really
always.
acknowledge it.
I'd also really like to thank Dorothy and Steve and all of CRC and all of the applicants. I came into this process very late to the party and needed to be caught up in a big way. You were all so generous with your time and efforts, so thank you so much.
No, thank you.
No one is more committed than Dorothy.
It's true.
Thank you, Denise.
I was on the CRC for 2 years, and I wish all the town spending went through the same amount of rigorous scrutiny that the CRC spending goes through. Just kidding, Brian. Just kidding. I know it does, Brian. Dorothy
does a great
and
job.
Bert, you're here.
Committee.
Or Bert was here.
Linda.
Linda's here.
Steve.
Yes, I know.
And I should make it very clear, it is always very good to have, I mean, we have Denise and then we have Steve, and can I tell you, to talk about people keeping us in financially like on the nose, these two do an amazing job.
Well,
doing it.
you put a tremendous amount of effort into it. Our community is much better off for it, and thank you.
Thank you very much, Denise.
Thank
My
you.
pleasure.
Do we get a motion on this now?
I would love to make a motion to accept the recommendations of the CRC.
I second.
All in favor?
Aye.
Thank you guys, thank you very much.
And John Balash, let's not forget John
Oh,
Balash.
yes,
He's on
and
there.
John.
Yeah, he's not here, but
Okay.
should be remembered.
Thank you very much. Chris and Jill, please come back. Okay, next up is Grant. Please.
I'm gonna yield the microphone to Julia Linder,
Okay,
who has a little more information than I do.
okay, thank you. Why can I never remember the number of this article?
Julia, do you know the number?
I have it, 69.
Found it.
It's not there. Article 69, please, Ally. Is it already up on the
You
wall?
probably think about it like two.
Think about it as letters still.
Hi, Julia.
Thank you, Madam Chair. We have continued the discussions with some of the stakeholders since our last meeting, but this is pretty much in line, I think, with what you may all have been expecting. We earlier today sent the chair, and I earlier today sent the chair an email requesting that FinCom consider an amendment to the article in your motion, and that would be to strike the hours or the restriction on hours of delivery out of the article, really to turn it into something that's I hope much more palatable by everyone, which is purely a data gathering effort. And my understanding from the discussions that we've had with some of the representatives from the restaurant owner community is that this is quite in line with what they were hoping for, at least. And it's in line with what we're quite satisfied to move forward with as well. And I think that what we found is there has been certainly a benefit to re-examining this question of downtown deliveries, and to the I should give credit to the traffic safety work group, as well as the steamship for working along some progress that's going to be implemented next summer. None of this is earth-shattering, but that's not to say that it's not continuing the progress that's been going on without Act Now at the table, of course, for years and years. But it's always good to re-examine questions, and we're sort of happy with the situation where it is.
Thank you, Julia. Did everyone, I forwarded Julia's email to me, to all of you, so I didn't know if you have a chance, did you have a chance to see it?
Julia, is this without this, would the traffic safety work group be not doing this study?
So it was never the traffic safety work group. I think the traffic safety work group has certainly been helpful. In particular, Representative Nat Lowell from that work group has been, but we can talk about the town and public safety and other folks who sit on that work group, yes, are clearly committed to improving the situation. But nowhere in this data gathering effort would we expect the traffic safety work group to be the resource that needs to be taking the load. Does that make sense?
Sort of. I mean, but who would be the resource taking the load?
So
Other than
Act Now is absolutely
Act Now would
suggesting
be-
that we
okay,
would
that you would
put
do
the
it.
resources.
Okay,
Absolutely,
that's what I-
absolutely.
So you're gonna do this work?
So that's what the explanation, I think, in the application for the article, that's what the explanation suggests, that Act Now has always volunteered its time and effort in whatever work would go into any data gathering.
I don't think it's stipulated. In the,
Yeah, I don't think this is clear.
So
It's
in the
not stipulated in the article
Yeah.
itself.
no, in the explanation behind
Right,
you,
on the fact sheet.
which is in, yes. So there's a questionnaire that goes with every article that the town suggests we fill out, and the explanation was in that questionnaire, and stipulates that Act Now volunteers its time and resources.
totally different feeling knowing that there's somebody to do the work.
Right, yes. Otherwise, we would be without a funding source, and that would be a problem.
I'm still unclear on why you need this.
We think it's, quite frankly, positive to take a look at what information we don't have, because at this point we have nothing. We have very little, and it's a piece of the puzzle. You know, there's a lot more to congestion than certainly trucks.
I'm sorry, I should have been more clear. Not why you need the study. I'm not clear why you need the warrant. Why you need to go to town meeting for you to go do a traffic study.
We don't. That's right. We don't. I think that it's, from our perspective, it's certainly not a bad thing to get the town to consider it on town meeting floor. It's something that we could do independently, you're right, without moving ahead with the article.
Or let me ask it a different way, I guess. Is there anything that you couldn't do independently that you need this for? That,
No, I think that
the resources are in the explanation, not here. But is there anything else, permit-wise?
Nope.
And how will this information be made available to people? And how will they be able to participate or give any kind of input into the process?
Well, I think that again, if you sort of refer back to the explanation, it's definitely working with the town in a sense that we know there's a framework that exists. There are some stakeholders that are there, and we have to, it's not something that's going to be done in a closed process. If it was done in a closed process, we wouldn't be at this table.
Well, wait a minute. How are you going to keep that an open process, that kind of, the study itself?
In a sense, any information that we gather is something that the town will absolutely obtain. There's no reason that we would not share any of the information. Any person who wants to see it, there's not going to be proprietary information that won't be able to be shared and all this kind of.
Okay. I just want to point out, because of your legal status, you're an advocacy group. And so being a 501c4, that means that you can be funded by people that we don't know who is behind that. So I'm uncomfortable with let's have the select board endorse what we're doing when they might not even know who's funding it. You see what I'm saying?
I think it's pretty clear who's funding us.
Well,
I think it's
we don't. You don't have to disclose that. So and that's okay. That's how you wanted to structure it.
So we had to structure it as a 501c4 because we're an advocacy group.
Yeah.
And we see that as a positive for the community to have an advocacy group, in a sense that gives us the ability as a community, if we choose to lobby, it's a mechanism through which we can, for things that might be stuck at the State House right now that we've all voted for a number of years, for example. A lot of nonprofits do amazing work on this island, but they cannot advocate. It's not within their legal structure, and you're right, that makes us different. But that doesn't mean that we want to certainly appear like we're not being open with the public about who is funding us, and it certainly will grow in terms of number of funders. Right now, it's only Peter McCausland.
Yeah. No, I understand that. And I'm not assuming that you're doing anything sinister. I'm not saying that. I think it's more the appearance that I'm struggling with for, you still have a point of view that you're pushing. So the data that you put together, especially when you fund the study, that's going to be to push your views, in my view. That's how you will structure it. Select Board's not going to sit there and go over every data point for your algorithm. So that's sort of something I'm just uncomfortable with. Again, I'm not assuming anything bad, but I have to look at protecting the town. I feel like that's our job here at FinCom.
I think anytime you hire a consultant, you have to be mindful, or anytime you do a study, you have to be mindful of what the question is, and that sort of leads you to the answer you're looking for sometimes, right? And in the case of Act Now, it is not a question of pointing the finger and then gathering the data. We knew this was an area where there was complete lack of information. But frankly, when it comes to traffic, it is. I know we have permanent counting stations that are coming online for some of the areas around the island, but we really do lack information. And so I view it as a positive to gather any sort of information around congestion or around flows of vehicles.
Do we know if the moderator considers this amendment within the scope of the articles that was printed in the warrant?
That I do not know.
Because it's just a deletion and there's no.
Pretty substantial deletion.
It is, but it's less than what was being proposed. So the voters have already been warned that more than what's currently being proposed.
Is that the standard sheet plot?
Yep.
My sense of this is that we might, as a board, be more positive about this if we had data, rather than jumping aboard before we know what the modus operandi is. We don't know what your samples are going to be. We're not certain. I mean, you're not certain how you're going to do this. So I'm not comfortable endorsing this for those reasons. I think if you want to go ahead, come back with the results, come back with all of what you've done and your methods, that would be a substantial improvement over what's going on now.
Well, I guess I would say that generally speaking, when we talk with, in particular, what the work that's already been done through the traffic safety group and the complexity of downtown deliveries, there are a number of situations. One of the situations that is every day of the peak season is this what Nat tells me I should call it multi-stop food deliveries. And
good for Nat.
Yes, and so he's
stopping to fix the stove right before the food comes.
Exactly.
Have you trademarked that, Mr. Lowell?
It's actually a real thing.
It's a scientific term. And so sort of to that point, that's where we're finding that some of the improvements that are going into next summer, that's the focus. And in that sense, that sounds like it would be the focus for any sort of data gathering, if that helps you understand. It's hard to give you data ahead of
I think that's good, but I just don't think that I don't think the town should be in a position to sign on to endorse this effort. I think when you put some meat on the table, then we can all look at it and make an intelligent decision. But I would recommend, I mean, from my own experience, that focusing on one relatively big in one way, but relatively small in another way, segment of what's going on for town traffic is probably a mistaken procedure. I don't think you're going to get from that the kind of picture that you're alluding to, and so I'm pretty convinced of that.
you certainly know I was not an advocate of this to begin with. But at the same time, I hate to look a gift horse in the mouth. If there's funds available to support this study on your behalf, on our behalf through you, is there a way that you can link in some part of the town to work with you on this so that it's not just an Act Now project, although it would be funded by Act Now?
I think we've already begun that process in a sense that, we have been meeting with, whether it's the transportation planner, whether it's public safety. We have been doing some work to figure out, I think there's probably a little bit more needed, to your point, in terms of figuring out exactly what would be the most helpful to them. Ultimately, it's not just about Act Now. You're absolutely right. But I think, George, to your point, we are definitely considering a much larger study of congestion, and we've talked to a number of organizations on island about, who have already talked about and thought about these things and what would that look like. And I think that there is a bigger picture here. You're absolutely right.
Jason, you know how much I like when a select board member comes to a FinCom. So my question to you is, again, Julia, you and I have had this conversation where, you're asking town meeting to direct the select board to do a pilot program. And I'm looking at both Jason and Libby to say, it's a non-binding directive, number one, so you don't really actually have to do anything. But secondly, is this something that really the select board's gonna go, oh, great, thank you for this? Or I would appreciate your thoughts on this as we're considering it.
I think if it was to pass as is, we would probably say, great, do we want to do some our own version of this? Right, and what does it look like for 2021 or 2022? But there's no funds coming to us, right? So in an entity like this, the strength is they can move really fast outside of the slow municipal red tape. The kind of the challenge or weakness of a group like this is they can't come to us and give us money to put traffic counters around to help us, right? It's kind of just directing kind of what they want. So it doesn't really, we haven't talked about it. This is a warrant article. So select board and Libby, we don't really put a lot of time into it.
Yep.
I know you have to make a decision, but it's I think we're doing enough. We're doing other things that are kind of in this.
I don't know.
This section of trying to.
Sorry, I'm answering his question.
Give alternate transportation to downtown. We have our other goals.
Mm-hmm.
So in a way, it kind of goes in line, but it's not going to help us at all.
Okay.
Particular article.
Libby, would you give us your thoughts, please?
Of course, would agree that everything that Jason said, and I kind of just go back to anybody could do this study at any time right now without any kind of town meeting vote or any approval from the board. So if it's very important, then just do it.
Mm-hmm. Thank you. I know there's members of the public, I believe, are here. Does anyone want to speak to this?
Please,
Nat?
let me try to put a cap on this party.
Thank you, Julia.
What
Don't
is
go
that
far.
metaphor? What?
The cap on this party. Don't ask
Put a
that.
cap on the pie?
Listen, thank you all for this. All these people back here have my cell. And this has been quite a winter. And I basically told all of them, don't worry about this, everything will be fine, but I didn't know it was going to quite get to this level. So, I'm friends with everybody in this room, even if I don't agree with them. That's how I operate. I like to stay behind the scenes. I don't like my name getting brought up. I don't write letters in the paper like I used to, always 2 a year. I got a lot of hats, and I appreciate being able to have them, thanks to the selectmen and the voters. However, back in the comp plan days, there was talk about breakdown bulk, building warehouses out of town. Why can't Cisco buy a warehouse? Been through all this.
for years. It's never gonna happen. So now we're here with earlier boats that no one knows are earlier, but they are. We have Hyannis agreements. We have hours of service for drivers. All them trucks you see come off that boat have computers in them. Those guys are tied to them computers like their shoes. And they can't just hand that truck to another person, okay? They got 8 bazillion pieces of paper spitting out of machines in those trucks for one bag of onions, okay? It's insane, okay? So I've been working on this stuff, little tiny things for years with Flint and with Rob and with management at Steamship, with Muffy, the driver from US Food that retired, with the other guy from Cisco that's still working. I don't know how he's doing it. And with Jay Lovering and Matt Maltby. And it is not easy, okay? You witnessed the sand meeting last night.
Yes.
The sand thing might be harder than this, but it's just as difficult if you want to use a comparison. So with what ACT now is doing is really similar to what other groups in past, like Sustainable Nantucket, they've all tried to kind of jiggle this stuff around. We're still an imperfect downtown. Nothing's perfect downtown. We're not Arizona. We can't, we don't have perfect crosswalks. We don't have perfect sidewalks. We have cobblestone streets with 50-year-old guys trucking stuff across them with a dolly.
Yep.
Dropping cases of tomatoes and stuff on the ground. Yep. This is what they do, okay? We can't ask them to go faster. We can't ask them to come earlier. They don't control the boat. They don't even know who we are. They just know the stops, and they know the sneaky places to back up and the sneaky places to look for. So I've been able to help with a couple of things. In the last couple of years, we finally got approval from traffic safety. I am not on the traffic safety work group, just for everyone's information. I just happen to be, can kind of try to do something through them. And I have, and I'm really excited about working with the police chief and the fire chief and water company and the other members to approve a couple of little tiny improvements this year. That's what Julie is talking about. They will help, but it isn't gonna, you're not gonna see it. See, that's the other part I want everyone to understand. If every truck came at 5:30 and got here at 7:30, you think that there'd be perfect deliveries and everybody just be all set? No, they'd have actually more problems because they wouldn't have enough places to deliver from. So there's a certain element on downtown where you have to move, spread out, like somebody comes in, they get done, and then all of a sudden another truck is trying to circle around Broad Street. That's how it really works, and it's terrible. It's not anyone's fault. It's just how Nantucket's been designed before vehicles were even invented. So we're sort of dealing with that. And, I just want, I think that this is what I think the good about what ACT now has done. They brought a lot of attention to it. I mean, there's people coming to these meetings that never have even know that we had these meetings. And I think that that's a good thing, okay? It's true. I mean, it's sort of like the tent article, like all these people I've never seen before show up at our meeting. But this is important because it is an issue that does need to have attention, like the sidewalk issues that's been brought up this past year that everybody sort of freaked out about. But it's been an issue for 50 years. It's just no one talked about it like that. So I think that this is in the same ballpark. I'm not going to tell you people how to vote. That's your department. I like to stay in my lane. I just need to get this out because what I've just said to you is 100% fact. We're trying a little at a time. There's other things in the pipeline to, it's hard to explain, like standby for food trucks. They have #1 priority. Mm-hmm. They have #1 wait list priority. Like these things are huge to get through the steamship, which is really difficult, okay? But again, when a food truck gets on an earlier boat because they got a wait list match the day before, what are they they have a flag out the window saying I got on an earlier boat? Nobody knows. Right. But the people downtown know when something's working. They know when something's not. Okay? And even though we're not a perfect place, it's as good as we can do right now. Okay? I mean, Broad Street was two-way a few years ago. It isn't now, and it works really good. So they see there's one improvement that no one thinks about anymore. Those are the kind of things that we've been doing. So thank you for your time. Appreciate it very much.
Thank you, Nat. Are there any other comments? Any?
No, this is not the revised.
No, it's not the revised.
Yeah, so anybody
No,
looking at this is,
that's not the revised.
Yeah.
No, it's the one
So
I
we're-
sent, it's the one I emailed you
right,
today.
right. So we're not talking about whether we agree that the hours should be changed or the weight should be changed. All we're voting on is whether a study, that the select board should be directed to do a study. Approve a study done by somebody else.
Okay, now, as we all know, I'm not the technical expert on these things. And so my understanding of this is, if we were to vote motion to adopt, it would be motion to adopt with the changed wording that we got today.
Right.
Do you see what I'm saying?
Yeah.
Otherwise, motion to take no action and motion not to adopt, it doesn't matter. We're just voting on what is in front of
Correct.
us. And then prior to town meeting, Act Now would send their proposed wording changes to the moderator and then change it on the town meeting floor. Okay, I'm declaring victory on knowing that and getting it right. So, well, I asked Libby right before the meeting, so if I had forgotten it in the 20 minutes we've been here, that would have been bad. So, anyway, that's what our options are now. So, as we make a motion, if it's motion to adopt, it can be motion to adopt with their new proposed wording, taking out the delivery restrictions.
I have a question.
Yes.
I have a question for you guys. Is it the piece about directing the select board that you object to, or the piece about Act Now doing the work?
It's the piece about directing the select board. I don't have a problem with a private organization doing anything they want to do.
So let me ask a question. We've had these other sorts of citizen warrant articles where people want to have a sense of the meeting, right? What if this just got changed into sense of the meeting kind of a citizens warrant article?
I'm not sure that applies well here. Sense of the meeting, should we be allowed to count traffic?
Yeah, but sense of the meeting, should we save whales? I mean,
Well, I think those sense of the meeting things typically have with them, should the town then seriously consider following on and doing something itself, right? So I think I'm with Steve. I'm not getting a sense of the meeting, should this private organization be able to go off and do something that it's allowed by right to do? And I'm not getting it.
so you oppose the allowed by right? That you oppose the fact that...
No, not at all. I think they're allowed. I oppose the notion of bringing to town meeting floor something that doesn't have to come to town meeting floor, to then put it on the selectmen's agenda, put another burden on Libby, who one of the people I know who probably doesn't need many more things to do, and it will be something. Even if they're paying for it and doing the work, she's going to be updating, she's going to be including, and it just doesn't make any sense.
So I don't 100% know if I see it like that. So here, is this a important distinction, right? Is it that, because I see it as, can they help the town, right? I get all the things that you guys are talking about, but is there a way to make this a better sort of compromise so that Act Now can help the town get this information if in fact it's important?
Well, if they did the work, the assumption would be they would share the information.
Yeah.
And then we could make that decision. But in this case, where we are now, I don't think we can.
I think that to me, it's just putting the cart before the horse. They want to get support and credit for something they haven't done. And so I don't like that, because why would we look like we're endorsing something that we don't know really what, again, we don't even know their parameters. Leave aside the legal structure.
I mean, they're not going to, it's not a CIA investigation, it's a traffic study, right? So I'm not really sure what bad information could come out of this. I mean, I'm sensitive to the fact that I don't think Libby needs to have more work.
Right,
I am.
but
But if
that's
this is
exactly what this is.
That's what-
It
unfortunately,
says
that's
to
what the
direct the
article is.
select
It's
board to
directed at the select
develop
board.
a program. It's not about,
A pilot program.
This can be done without anybody in town government saying yes.
right, and I think, if we're not going to support it, I'd like to see a comment that recognizes Act Now and thanks them for their interest and encourages them to move forward, but without the
Yes.
town.
Yes.
Jason as one board member, not for the whole board, but he said if the select board were to take this up, it would be a year or two out. It certainly wouldn't be by June 15th of this year.
I agree. I think this is helpful, and I don't see a nefarious reason for Act Now to be studying the traffic. Like, I don't think there's a collection of traffic information that's gonna come back and be
Right.
like, you people are bad, you did something wrong.
No, it's truly.
These mushrooms are illegal.
I mean, from my.
No, that-
Okay.
Whatever they're counting.
Yeah. I got distracted there for a moment. For me, it's to direct the select board, and when they could just do it without having to do that. So that's my issue with the article itself, and that it could be done without needing an article.
And then my other question is really, we have people from the restaurant community here. Are you planning to work with them if they do this study?
Right from the get-go, we've been offering our support. If they talked to us before this had even been drafted, we would have been happy to do it. I think it's speak for most of us.
I mean, this is to make everything better for everybody. They don't want to hurt anything. The way it was handled was probably done wrong to begin with. Again, if it's going to take, I think, Jason, when you said 2 years, does that mean doing it on your own, it would take 2 years? Or do you think if it was, direction came to you to endorse it, it would take 2 years?
I just think in general, I just make up any entity, the town meeting directs us to do this, it's not happening this summer, no matter where it's coming from. We wouldn't know until April 14th.
Right.
Procurement and like who's doing what.
So it's actually an advantage to them to do it on their own and then come back to you guys with something that they've done and go from there.
With the key stakeholders involved.
Exactly.
The select board's not the stakeholder that needs to be involved here, actually. They'll hopefully listen and they'll have a great study and make a lot of news with it, and that'll get their attention. The stakeholders are the people sitting over here. So that's who, and many other people who aren't here. So that's who I hope they build that coalition with to do the study. And then I think they'll have a compelling case.
Is there any more public comment? Because otherwise I have to close the public comment part of the meeting so we can make a motion. Are we ready to make a motion?
Yes.
So I'm closing the public comment part. I'm sorry. First I said I was going to ask you if you had anything, and then I was going to close it, but then I closed it. So does anyone have anything they want to say before I close the public comment? No? Okay, thank you. Close for public comment. Okay. Now are we ready to make a motion?
So what are we making? We're making a motion to
So if we do motion to adopt, we did motion to adopt with revised wording that takes out the delivery restrictions.
Okay, so it's motion to reject.
If we do motion not to adopt or motion take no action, then it's just against this particular article as written on the wall behind us.
I make a motion to take no action.
Do I have a second?
Second.
All in favor?
Aye.
Wait, with and note or a comment
Yeah.
Yeah.
that Stephen mentioned.
Which Stephen just volunteered to write. So his hand go up,
Sorry.
Sorry, Joe's not here. Joe's our comment writer.
Fair
Yes.
enough.
Our secretary.
Okay. All in favor?
Aye.
Aye. Any opposed? Okay, thank you. Thank you, Grant and Julia.
Thank you.
Now, we talked about, and one more thing before Julia leaves. I'm sorry.
I'm not leaving, I don't think. Well,
Yeah, well, you're not on the 5:30 boat, that's for sure. So, yeah. Another good night on Nantucket, Julia. Now, you and I spoke before when I informed you that we voted motion not to adopt on the leaf blowers.
Correct.
And when we spoke before, you said that potentially you had new information and potentially you were going to ask FinCom to reconsider that. Is that you're going to live with motion not to adopt and we're done, or because you're here? So, and we're running out of days that we can do anything.
We certainly are. I wanted to give the board a chance to hear someone who's gone through the experience of using electric tools instead of it being from my mouth, someone as a non-landscaper. And I would wonder if you would consider opening up the public hearing. I'm not sure if that's the technical, but reconsidering your vote on, or your motion on the article.
Is that person here now?
Yes.
Oh, there we go.
I'd be more interested to hear if you've done any more polling. You had talked with roughly a third of the landscapers you'd identified.
Honestly, there's quite a few folks off island right now, and it's been a little bit more
goes our
difficult to.
audience.
Yes.
Thank you.
Thank
I
you.
don't think we should have saved that till later.
And thank you for all of your time on the previous article.
Wow, really leaving.
I mean, just speaking as one member, I'm not concerned that they're not a good application for some landscapers, or maybe for most landscapers. My concern is foisting upon an industry some rules before we know if it's going to be widely adopted. I don't think that we've demonstrated a great need. I do think that there are some benefits, but that it doesn't raise to the level where I would consider the town enacting a bylaw on people before we even find out what they think about it.
I agree with Stephen.
I guess if you'd like to give a chance to reconsider, it's up to the board. But I do have a feeling that, you know, there is a large group of the population out there that is in favor of reducing noise level and improving perhaps quality for everyone with this kind of change. I may be wrong.
But isn't that part of what you should do as the proponent for a change, is make the case that there is a large group of people who want this, and these are the people, and these are the complaints, and this is what we're going to address, and the affected people, the most affected people being the landscapers, here's how they feel about it.
Well, to some degree, you know, I think that we took the torch from a couple of people, and including the notion that the town was considering it in the first place. I think that we've spent a lot of our time working on those who we thought might be more difficult to adopt, to move forward with, in a sense that who would be opposed. We would think it would be landscapers if anyone was. And so we spent a lot of our effort towards that. The overwhelming sentiment that we get back from, and I don't have a specific survey to point to, but the overwhelming sentiment from outside of that group is that it is positive. And you can imagine in particular folks who live in areas where they are more affected than others.
So I can imagine it, but the survey is a good point, because I've spent far too many hours between midnight and 2 a.m. over the last couple of weeks watching and rewatching planning board hearings from the last couple of years on swimming pools. And you were very good to stand up at a recent meeting and offer Act Now's support in conducting a survey to find out what the public thinks about restricting swimming pools, but we don't have that same kind of information for this article, and that would have been helpful for me.
I appreciate that. A lot of the polling that goes around this sort of thing is sort of in the next, you know, ahead of town meeting. And sometimes you see articles even before some of that polling has happened. I know, you know, there's an immense opportunity that Act Now wants to take advantage of through the civic associations, for example. There's already a great established opportunity to poll, but polling the general registered voters is still quite a challenge, and I think that we hope to get there, but that's still a fair challenge.
Fair enough, and maybe you do need time, or somebody needs time to develop that infrastructure to poll those people, right? But we do know who the landscapers are, and we haven't yet polled them, and we do know who to call to find out if there have been complaints, and we don't yet have that information either.
So I can report back on both of those. One is what we've polled is we haven't gotten more than a third of the 100 landscaper list back, and the majority is in favor.
Is that the same 25-7 data that
we
we
probably
saw?
have 5 more. It's not substantial. I think what we found from public safety was a little less insightful, which was we do monitor noise complaints, obviously, but we don't monitor the type of noise complaint. And so it's really hard to present to you any information on general noise when we don't know what the source is.
Julia, why would a landscaper be in favor of it? I mean, what's to their advantage? They can go out and buy electric ones tomorrow if they want.
That's what he can tell
May
us.
I invite
Yes,
Steve to
please
the
do.
mic?
But your question is a little different, not why would they want electric blowers, your question is why would they want
Yeah,
legislation?
yeah, exactly. That's what I'm saying. Not why they'd want electric blows, but why would they want legislation
And so,
requiring everybody to have
As
one?
he's patiently sat here this whole meeting, I would actually appreciate hearing what he has to say.
I agree. Steve Gillette, I work for Ernst Land Design.
Thank you, Steve, for being here.
I think to answer your question directly is a lot of things need to happen that people don't want to make the world a better place. I would kind of ask you something I was just thinking about.
Ain't that the truth?
Well, you think about some of the parks and places that we have around town, and smoking is banned for the reason of it being bad for people, but yet you're sitting here saying that two-stroke motors are okay to operate in these areas. So a piece of legislation like this would kind of correct those kind of hypocrisies. So what we did as a company, I want to say 2 years ago, rules aside, we decided that we were going to make a push for noise reduction, environmental protection, and we made a large investment with not just gas blowers, but also hedge trimmers, weed whackers, anything that we saw would, I guess at the time, looking at the technology and what they had, what made sense. Not looking for gimmicky items like some of the blowers that first came out. And we just made a very conscious effort to switch all of our crews to these items, and all we've heard for 2 years straight is positive feedback. To listen to polling from like the police department for noise complaints, I would feel confident saying that the majority of people complaining about noise, like in the downtown Hobart Avenue area, probably aren't going to file formal noise complaints for the things that we do, because it's like an understood practice and profession that we make noise. The same as you probably wouldn't call a noise complaint in on a carpenter building a home. It's kind of just something that they accept. So if you were to give somebody that option, like please call, if you hear a gas blower, if you hear something loud like that, I think you could alter your data pretty substantially and fast.
So can somebody, is the article up there? Can somebody go to 79?
Aren't you kind of making the case that you don't need the article because you've already done it and you think it's worked and it's given you a competitive edge, it sounds like.
Well, the free market, I think, eventually will level everything out. But for, again, bringing up the cigarette argument, wouldn't the town want to put its best foot forward in making its public and, all the public parks and areas as environmentally friendly and safe for the inhabitants and tourists as possible? I mean, noise aside.
Where do you rank in terms of the landscapers on Nantucket in size?
I couldn't tell you that. I wouldn't, unless
Would you be in the top 10?
I would assume.
Okay, so wouldn't it give you a distinct advantage against a small guy if this was enacted as legal responsibility?
You could say that, but our business model doesn't work that way. We're not looking to consume smaller companies.
I'm not talking about your business model. I'm talking about the small guy who has to compete with you, and he has to go out and spend all this money.
Well, no, because the price comparison is an equivalent. I would say, because I work on some of our equipment as well, I would say in a 2-year span, the cost of owning an electric blower actually becomes cheaper because maintenance is reduced. So I would say that if you make the initial investment, so if you're going to start a company or switch your equipment after it becomes old, you're going to save money in about a 2-year span. So I would say no, financially we do not have an advantage being a bigger company.
You don't have any relationship with any manufacturer of this equipment?
No, we use the local outdoor power.
You're not Mr. Toshiba's kid?
No. We've actually reached out to companies like Steel, and we try to establish a direct relationship, and they've been good about redirecting you back to your local dealer, which is one per county. So they're not trying to take business away from the local guy. If anything, they're trying to push it onto him.
So the reason I asked for this article to be put up on the screen is the explanation just doesn't seem to comport with the available facts. Complaints regarding gas-powered leaf blowers by property owners and garden contractors has been increasing as the use of these tools has also increased. I don't know that the use of the tools is increasing. I don't know that the complaints is increasing. We don't have the information to support either of those things. And it rubs me the wrong way that we put this forward. If it really is about the lung health of people nearby, then let's talk about the lung health of people nearby. If it's that people don't complain about them because they've come to accept it, then I don't know how much we're improving the quality of life for the people in the neighborhood.
Might be for the employee.
Not to, yeah, well, that, but when I say the people don't complain, I mean they don't formally file noise complaints, because where else would you would have to go door to door and knock at private property and ask, does the sound of a gas blower annoy you?
Well, we wouldn't have to, because somebody is purporting to hear these complaints. So who is that person? I haven't met them yet. They haven't come to one of our meetings.
Well, I guess for a first-hand experience for myself, I would say from the time that we implemented our electrical equipment to now, we have, in a 7-year span before that, when we used traditional gas-powered equipment, we never once received a compliment or a question about any of the equipment being used from a client or from a neighboring person. Since we've switched the electrical equipment, multiple clients have come out, asked where we got it, how we obtained it, complimented how quiet it is, complimented the equipment itself on how well it still performs the job, and have asked for the information to pass along to their landscaper. I think that my point is that that kind of interaction is going to be very hard to obtain, because that would require Act Now coming to me and every individual landscaper and hoping that we openly share those stories, and then you'd have to go and verify that information somehow. So,
well, I think what you've just illustrated is that just by having these out there in the world, their use will increase because people like them very much. But I'm not sure it's the role of the town or any government agency to tell people they have to do it.
I see. No, I can see.
And at our meeting, our prior meeting on January 28th, there was a preponderance of people who were not in favor of this article. So it's again, you know, to the points that Stephen was making and why we ruled the way we ruled at the time is it is tied to, you know, as it's written, it's we don't have facts that we can support when we take a look at it and try in the most, what's the word, not independent, but in a objective way. So that was a lot of the discussions that we had. Yeah. But I appreciate very much you coming and giving us that information. I think, you know, as I've shared with Julia in a phone call, I do think over time, all these things are just going to happen because it will give landscapers a competitive advantage. If someone says, oh, who am I going to use? Oh, well, try these guys because they do this. But the fact that the town needs to legislate it, that's a separate topic.
I think that what he's also saying is people don't know what they don't know. So
Right.
if you're used to hearing the noise of leaf blowers,
Right.
then you're used to hearing the noise. And if so, all of a sudden one morning there's no noise, but the guys are out there and they're doing something new, you notice that, right? So it's not really complaints; it's the absence of complaints.
Those are harder to count.
Right.
Yeah. Okay. Thank you very much.
Thank you, guys.
Thanks.
Thank you, Julia. So I'm sensing from our discussion, closing the public comment part of leaf blowers, that we are not reopening it.
No.
Okay.
No, but just point of information, because Chris sent it to me maybe a week ago. We reopened a vote with a motion to reconsider, which, according to Robert's rules, can only happen within a meeting. And that's just a simple majority of people who voted in the majority. And it's a motion to
Thanks.
Motion to rescind is what you need. if it's not
motion
the
to
same
rescind
meeting.
if you go
Oh,
to
is
another
that what you
meeting.
do?
Right, and that requires a 2/3 majority,
Okay.
not just a simple.
Or it can be posted, or as long as there's prior notice of at a later meeting.
Okay.
There we go.
There we go. Thank you.
So let me ask, so is that explanation going to be on there? I mean, there's no,
Yeah, it's in there.
yeah, I know, but they're talking about editing the deliveries articles, so
I don't
is that all gonna get changed in the warrant?
So we need a comment.
No, the deliveries
No,
article, they wanted to
I don't
offer
need
the
a comment.
amendment,
Well,
but
To explain that this explanation is not factually supported. It's misleading.
What are you talking about?
the explanation underneath the article, Peter, where it says complaints regarding gas-powered leaf blowers by property owners and gardening contractors has been increasing. That
But
is,
that was written by the person who wrote the article, correct?
Yeah, we can't change
Yeah.
anything that's written by the people
Right,
who,
we
by
can write
the
a comment
citizens.
saying that the
comment.
explanation above is not supported by facts.
Is
We
that our
can, I don't
responsibility?
know if it's necessary,
We had a discussion about this before, and since I'm in the habit of rewatching old meetings anyway, I'll get
It's 'cause
back
you're
to
feeding
you
that baby, I
around
hope.
3 o'clock this morning. Yeah. I've watched every Netflix show I've done. I've watched it. I'll
Is there
review
a sleeping thing that we need to talk about?
it.
No, he's a baby.
It is. It has to do with a 3-month-old baby. It's not my issue per se, but
Well,
Don't
it
let
is your
the
issue.
stranger no one watch
It is
that.
now, but.
Okay.
But we couldn't go through and verify the truth in every one of these articles.
Why are I'm just curious, why are the explanations allowed, I guess? Just,
Yeah, maybe we shouldn't have.
you've just always had them?
It came in as part of the article.
So voters are gonna come, they're gonna read this, and then they're gonna make.
I understand what you're saying. I just.
Right, so.
But we
you know,
can stand up at town meeting floor and say there's no facts
We
to
could also
support this.
add that, I mean, we have comments all the time.
We do, I like to use them judiciously, so if this
Well,
is
okay.
important, we can add this one.
I really would like to go back and watch it because we did have a discussion about adding a comment about just it was this article.
I remember you
where it
raising this
came up.
point with
Yeah.
regard to explanations in general. I don't remember
Yep.
the resolution of that
Yes.
conversation, but they're
I
gonna
remember
come,
the
they're gonna read
conversation.
this. So if you decide this is not a judicious use of comments, fine, but I think it's important for us to say the reason we are not in support of this is because the explanation you read above.
That's fine, that's fine, I
something we
just
can
wanna make sure
support
that,
through the conversation.
I wanna make sure as we go through and do comments, that we do comments on the ones we need to, and if this is one of the ones, I'm fine with it. I'm just saying I don't wanna comment on every one, so.
Fair enough.
Okay, now, thank you. We're standing there wondering what we're doing. Jesse, did you have more information on the real estate pieces for the land bank articles? Thank you for your patience.
Sat here the whole time.
She was riveted, I can tell you. She wasn't even looking at her phone.
She wanted to hear about leaf blowers.
Again.
So this concerns Articles 93 and 95, which were submitted by the select board, and involve dispositions of land bank land or interest in land. And I think, and Libby can correct me if I'm wrong, they were submitted because we've been having conceptual conversations about what the town needs as far as land by the Rotary for improvements to the Rotary. And I think the article includes for utilities, for road improvements, for bike paths, and I think that's it. And then also easements at another property in town on Angola Street for stormwater infrastructure drainage purposes. So land bank land is protected by Article 97 of the Massachusetts Constitution, which protects all conservation land that's purchased with public funds, and therefore has to go through a legislative process in order for us to dispose of it. And that process includes review by the Executive Office of Energy and Environmental Affairs, which reviews them according to a no net loss policy, which basically means that we have to replace any conservation land that's disposed of with equal or greater land, or the value of what we're giving up, so that we can purchase more land, so that there's no net loss in conservation land for purchase with public funds. So that's where this started, and or that's the background, and really in consultation with our overseeing agency, EEA, these articles, we've been through this before, we've been down this road before with swaps with the town, and they really should be submitted at town meeting with all of the details and the complete package, basically showing the quid pro quo, not just what the land bank is giving up, but also what the land bank is receiving in exchange. And right now we don't have definite plans for what the town wants to do. We have not seen any specific, I think we saw maybe a sketch plan, but we don't have the specific, we haven't seen a definitive plan for what the town wants to do by the Rotary, and we haven't seen any definitive plan for the stormwater infrastructure for the other article.
Okay.
So in order to even have the conversation with the town, we need the plans to be able to talk about an appropriate mitigation for these dispositions, and we also need to have a memorandum of understanding, and it just needs to be presented as a complete package and go up to the legislature, presented to the voters as a complete package presented to the legislature as a complete package. And that way, because like I said, we've gone through this before, and it's just, it ends up being very confusing. And that's it. And I emailed Libby earlier about it, and I think the select board's in agreement and they understand. And
The select board hasn't heard this, because it just came up today, and obviously we had a meeting last night, not today. But I did check in with the chair about it, and also Ken, and we have no problem with putting these off to a later time. We hope we can bring them back with all the information that Jesse is talking about to the special.
Okay, good. Thank you.
so I don't know what I'm asking for as far as a recommendation. In order to accomplish that goal, I'm sure you know.
Take no action.
Okay.
Great.
So is someone making a motion?
Make a motion to take no action.
Second.
All in favor?
Aye.
That's 93. And on 95, may I have a motion, please?
Motion, take no action.
Second.
All in favor?
Aye.
Thank you.
Great, thank you.
Thank you, Jesse, and thank you for your patience.
Yes, absolutely.
Jesse's just dying to join FinCom, I can tell now. Because look how exciting it is.
Some years we haven't had a full complement of board members, and then it's nights like this where I'm reminded why. That was like paint drying. And I
No,
contribute.
I'm
Well-
telling you, the sand discussion, I'm telling you, it could have been worse. So,
Yeah, I think that's really interesting, actually.
What, the sand?
Yeah, I think it's fascinating.
I learned just on
I'm not sure
Facebook
half an hour of it.
I like to see the town.
algorithms with regard to wet sand. And we drying it to percentages of volume.
Well, we're FinCom. The town got money for it. It should be good. Like, we're for the town getting money.
150% more than the second bidder.
Wait,
Brian, do you want to take us through Article 4 and not, well, we went 9,
Well,
so.
we didn't, let me see what the.
Right.
So
Okay.
I don't think we can until Tuesday.
Okay, so you can't do 9
You can
or
do,
69?
No, you can
You'll
do,
do 69. That's the truck one.
you can do the truck one, yes, yes.
We can do the
I
real
think
estate
they're
ones.
59 and
You could,
60.
yeah, I thought you voted
Yeah,
the
those
truck
were
one,
just
yeah.
numbers.
You
did.
can do
Oh,
order-
okay.
You can write it down.
Even though
Yes.
you don't have the motion, you could do Article 23, which is the rescission of debt, because I sent the town manager a note
I
today.
left early on that day,
Move to take no
but I know
action
that
on
we
that,
did.
because the two that we thought we were gonna be able to, we can't rescind yet.
Sorry, I'm sorry, I'm still making
we
notes
did.
on. You said take no action on 69, correct?
Correct.
With a comment from
Yes,
Steve.
with a comment
With
from
Steve
Steve.
comment.
I'm sorry, which article number is
No, I'm not
that?
telling you now.
They'll write it at 3 o'clock
Maybe we
this
did
morning.
Yeah, that's when he sends out all his
We haven't
emails.
voted on them yet.
Okay.
So-
Alrighty.
So Article 23, as you
you
go
said.
through the rescission of debt, I sent the town manager the motion today, which is to move to take no action, because
Okay.
we thought we were gonna be able to, but we can't, because there's still some.
Hold on a second. Wait, Brian's giving us information,
sorry.
please, on Article 23.
So the rescission of debt, you could move to take no action, which is the motion that I sent to the town manager today, because the two that we thought we'd be able to rescind, we're not gonna be able to.
Do I have a motion on that?
Motion for Article 23, take no action.
Second? All in favor? Aye. Thank you. Sorry, guys. Alrighty. So we have to wait on, we voted on that. Do we want to go through the real estate ones in 6 minutes, or do we want to wait till Tuesday?
I don't think there's gonna be.
Burn through them now.
I agree, but I just,
Can we,
They're
or
fine.
is there just, you should ask the question, is there discussion on any of them, or
Right,
can we
that's
just make a grouping?
well, I don't think they're all the same, so I think some of them are
Maybe we can take 105 and 106 together.
105 and 106 together, yes, and the staff recommendation is to approve the taking and then the disposition subject to the abutter paying all the cost of survey required as well as cost of town council. So that's, we support the real estate, well, it's not the react,
We make the motion.
motion to adopt, right?
Yes, motion to adopt
Okay.
Article 105 and Article 106.
Do I have a second?
Yeah, those are East
105.
Hallowell Lane, right?
There's a motion to adopt, is there a second?
Second.
All in favor?
Aye.
Any opposed? Thank you. There we go. Okay, 107 and 108. So this was recommended approve the taking and then the disposition subject to the abutter paying all the costs of any survey required as well as costs of town's council.
Motion to adopt?
Second.
All in favor? Aye. Any opposed? No, thank you. Okay, Cherry Street.
This one looks like a tough
Yeah.
job. I mean, I have no objection to it, and I wish Ken good luck, but that goes like right through somebody's property. So, we'll see. Anyway, motion to adopt number 109.
Can I ask a question on the Union Park? These always come as citizen article? Why is this a citizen article?
I had the same question.
I should ask Ken, I'm sorry for not being clear.
Probably a citizen wants it for some reason, but it wasn't on the town's radar for any particular.
No, I'm sorry, I should ask Ken when he was here, I should have.
It became a bandwidth issue doing all of the yard sale stuff. Like, for instance, if we go back and look at 105 and 106, Libby's right that this has an interest for a person. Liz Finley doesn't own that property, but she's a real estate broker. We can expect that there's a need for that rear yard to be connected to that house. I don't know, you know, Jessie Brescher, obviously an attorney, so her client wants North Road. I don't know who Susan Burns is, but
Or Nicole.
so it's more important to these people than it is for the town. The town has, and Andrew Borsch specifically has other things he'd rather be doing.
Would it be that it's a development issue that planning is gonna shoot down because of a public safety issue of one road?
The Cherry Street one in particular was supposed to have been opened up for a safety issue,
Well, that's what Ken
and they
presented
just
as a
never
public
did it.
safety issue, and I'm
Yeah.
trying to understand why it's in a citizen's interest, unless they're a particularly risk-averse citizen, to bring it forth when it was sounded like the town was the proponent. And again, I apologize for not doing this with Ken. It's stupid.
You
And
know,
we should really have just, on every one of these, he should have explained what the,
well, he did explain that one pretty clearly, that it had been intended to be opened, it wasn't recorded, and now the town supports this.
It's probably
because
because
they're
somebody
just
has a
cleaning
bunch
up
of
the mistake.
maybe, and also it's probably because somebody's like leaving their stuff there. You know what I mean? And maybe people want them to clean it up, so maybe they want the town to take it back, and they're reminding everybody you're not supposed to put your stuff there. I mean, I don't know, but I agree. If you want him to come back and explain it, I'm fine with that.
well, if there's a background to each one of these articles, maybe it does make sense for him to come back.
I mean, I'm not gonna
next
ask.
week.
I'm not gonna ask for that. I just am a little.
Like why it's not from planning
I'm fine
board,
before because it sounds like it's in the best interest of the town.
but it's not from planning board.
Just process-wise, why it was coming from citizen confused the heck out of people.
I wasn't sure also why they weren't, like, why didn't they contact the homeowner, the landowner before it's in the paper? Like, the guy's gonna read about it in the paper and he hasn't been contacted?
Well, I think Ken hasn't because it's not the town's issue.
But it is the town's issue if it's a safety issue.
These are citizen warrant articles.
Right, but he's also asking for permission for the town to take this land.
He's asking for the town to have an easement, not
Right.
to take the land.
Well, for an easement, but he's saying if the guy doesn't agree to it.
Correct, then they can take
be
it by eminent domain.
But nobody's spoken to the landowner.
Correct.
And the landowner could read about it in here before anyone ever spoke to him about it, which didn't exactly.
I do think that's weird that they haven't talked to the landowner. Usually they talk to you
I
first.
don't know that they do. I mean, it's,
So you're gonna read in the.
In the yard sales, usually people know about the yard sales.
well, the yard sale, yeah, but this isn't the yard sale.
I'm sure they had when
Yeah,
they.
this is. This is.
It's not a taking yet.
Right.
I was just confused by that.
I mean, surely he's had that be notified in the mail.
These are citizen warrant articles. They put them in the warrant, so they're aware of them.
No, she's
no,
talking
this
about
is-
the affected property. For instance, in Cherry
Oh.
Street, the
Oh, that's
easement
what I'm
goes
talking
across
about.
somebody's property.
Okay.
The town
The
hasn't
victim.
notified any of the property owners because they're not town sponsored. We would notify the people if they're town sponsored. And I don't know what the public safety issue is, I just didn't know to ask him.
Yeah.
So it can essentially get approved before the people are even notified about it?
Well, this is what I
Well, there
was.
would be, I mean, they're publicly notified through the warrant process, which means they have to pay attention.
Yeah.
But obviously, if it passed, they would be contacted if we're going to pursue it, because these are just authorization articles that, you know.
Right. Don't mean they're for real necessarily.
I learned in one of my late night meeting watchings that warrant is derived from warn. That's what we're doing. We're warning the voters about things.
Excellent, thank you, Stephen.
Apparently we're not warning them
Man,
enough.
you're doing good.
My God.
What year are you up to?
Okay, so here's what I'd like to know. Moving on to K and L, because F and G seem, or 109 and 110 seem like we need some more information somehow.
So you want more information about what the public safety issue is?
No,
No,
I
we
don't, because
don't.
it was secondary access in the case of emergency if Blueberry Lane was blocked off and you
Yeah.
need to get to the other side of the
Field.
subdivision.
Yeah.
That's what that was for.
That's what it was for.
So
Yeah.
it's not, so they said it was a public safety issue, or, I don't know.
Ken said it was a public safety.
They
issue.
said they never, it says,
Probably what he
It
meant
was
is
laid
not
out on the
town
first
public
subdivision
safety
plan and just nobody recorded that easement that lasts like 40 feet.
issue.
So
Okay, so
we don't know
what
why
that is.
Susan Burns is interested, but we know why the town is interested.
in having the easement, yes.
Okay,
It's
so
all
I
in
don't
Ken's
get that
notes.
answer.
Nope.
Okay. Is there
We have the
somebody else that
answers.
needs an answer?
But he said, he did say, approve the conveyance to the abutter while recording an easement, which doesn't have to be 40 feet wide, to the town for emergency vehicle access, with the abutter paying blah, 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 like before. So, and record the easements as part of the, and that's why I asked the question, if the abutter doesn't give the easement, then what you do? And then he said, we take it by eminent
Well,
domain.
you could.
You could
Or we
take
just
it,
say, never mind.
or never mind, exactly. So,
Sorry about that.
so his recommendation is that we go forward with it.
And mine too.
Okay,
I move to adopt articles number
109 and 110.
109 and 110.
Is there a second?
Second.
All in favor?
Aye.
Aye. Any opposed? Nay? Oops, I didn't mean that. Okay. 111 and 112. Staff recommendation, approve the conveyance to the abutter while leaving an easement to get to the town-owned parcels in blocks 143 and 142, with the abutter paying the cost, blah, 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 blah.
Second.
All in favor?
Aye.
Aye, thank you. And then, basically, I think he suggested effectively take no action on 113 because it doesn't have the corresponding handshake, as I call it. Will have to be brought back in a special town meeting to have both sides, the conveyance
I
and
don't
the
think
acquisition.
any of these have both.
Yeah, they do. That's why we do 'em.
Okay, move not to adopt Article 113.
Second.
Okay, not to adopt, okay.
Oh,
Or
sorry.
take no action.
Thank you. Take no action.
Okay, just
It
checking.
means something. in real
Did you want to
estates.
re-second his take no action?
Second.
Okay. Take no action. All in favor?
Aye.
Okay.
No, I think we would have been clear not to.
That would have been good if it didn't come back. Make the wrong
I was afraid of that, yeah.
So,
Picture
just a
David
couple
stopping
questions
me
which
in an
Libby will
alley.
have quickly, and then we will be able to leave. Joe had sent us an email, and I didn't know the answers. And Joe couldn't remember that we always used to vote on this before, even before there was a price. But my understanding is, once it's approved at town meeting, then the real estate assessment committee puts a price on it, and then the select board actually is the signatory on, yes, this is a fair price and we're willing to dispose of it at that point.
Correct.
So the authorization by the numbers piece of it goes to the select board. By the price of the, because he's saying we're approving things without knowing how much it's going to cost or sell
Oh,
for,
yes,
blah,
yes,
blah,
That's
blah.
all not anything to do with town meeting.
Correct. All right.
Yeah.
So
I'm sorry, I didn't.
that was Joe's question to us. I couldn't remember that we always did this
Oh.
without knowing how much we're selling
Yes,
it for.
We always do it without knowing that.
Yes, okay. And I wanted to make sure my understanding before I answered Joe was actually accurate.
But you should tell him that in some cases, the people that are getting the land, of course, that they are probably increasing the ground cover, or it might have an easement where they can't or something. So he should know it is adding value to their property. If he,
Matt makes sure it does.
Right, and now that's why 4 years ago or whatever, we got the real estate assessment committee, and now also we have Ken. So hopefully, we're not getting hoodwinked out there.
Hoodwinked. Okay, you are full of little bon mots today. With that, any
Wait,
other?
can I make a few comments about? One is on the CRC. I didn't have the list of what you all had approved from your committee, so that's why I didn't know. I knew AAN had put something in, but I didn't. I don't know if you emailed.
We don't get the list ahead of time. Dorothy brings it to us.
She just did the presentation.
Okay, but that's sort of awkward because I didn't know, and I.
Right, but even I think in that case, if you knew that they put something in, then that would be enough reason not to sit.
Okay, well, I'm just saying, I think it'd be nice in the future if we didn't like look at it the day of. I feel like we're trying to do a good job here of giving us a little bit of notice.
We were supposed to have this. What was it, Taylor? Like a week ago or something, and then we had a couple of curveballs come at us.
Because I know things shifted and.
Yeah, it was the hospital graciously taking a second look at their application to include the ambulatory services, pushed us out about a week.
Okay.
Or
and
I definitely slowed some meetings down too.
yeah, also Taylor was like a real
pain.
I've heard that about Taylor.
So that's my first thing about that. This is my first year, so I'm trying to,
No, it's a good point. Nobody should be surprised at the meeting. So
yeah, I mean, a lot of those groups I want to be supportive of, and I would have asked a question or two, but okay. So again, when they're lumped together like that, that's kind of.
But they always are because they're in Article 9. So they always are because they're in Article 9. So we'd have to check again on the recusing, and maybe you don't have to be recused for the. Well, actually, you do. You have to
I'm sure I
recuse for the
do.
entire article.
Yeah.
Because if it's not going to one that you're on the board of, then.
Okay. And then the other thing I just wanted to mention, and maybe we can or can't have a discussion about it, but this reopening of votes, like I thought maybe that happened once. It sounds like this happened a few times, and it doesn't sound like we are. I just wanted to express my own view. I hope we don't do that because I feel like it just sets a bad precedent. And just today, I mean, that took up so much time, and I'm sorry that they didn't have their information to us earlier, and it's very kind of you, Denise, to have them back, and I was glad to listen to it and glad that there are some changes made, but I just.
Actually, it's not kind of me. It's actually, they're entitled to ask us to reopen our votes.
Yeah, okay.
So, and Julia had indicated to me that she was interested in doing that. So I am just following what she's entitled to do.
How are they entitled to do that? Just out of curiosity, I'm just confused on the procedural point there.
Yeah, it's according to the rules, as I understand
would
it,
have
and
been
I
in
could be.
public comment.
In any public, even in the public comment period, not.
Correct.
For things
Correct.
on the
Denise
agenda.
allowed it to happen subsequent to the other discussion we were going to have, but we could have made her stand up at the beginning and then sit back down and go back. Okay.
And for your information, that's exactly, I believe, what's going to happen next Tuesday with planning and the pools. They're going to be asking us to reconsider. So.
Actually, they're gonna be asking us to rescind.
And also,
Oh, rescind, yeah.
We've
Sorry.
rescinded other votes before in previous years.
Okay.
We have.
Well, that's
Because
what I'm
sometimes
asking.
more information comes along or whatever for whatever.
I'm not saying to rule it out. I would just.
Yeah. No, but it takes time.
I'm asking questions about the process.
A lot more of it this year, and not really based on
Tribe
very much
48.
more information, right?
We don't know that till they stand up and talk, unfortunately.
You're talking about the stuff that's happened already.
Yeah, no, I know, I'm just saying,
it does seem like.
they come back and say, well, I'll have a lot more information. We need a motion to adjourn, please.
Motion to adjourn.
Second, is there a second?
Aye.
All in favor? Aye. Joanna's jumping the vote.
Ready to go.
Thank you, everyone.
You were there. Thank you all so much.
I was.
Thank you, Taylor.
You were there.
I didn't write it down. No,
You were there.
Because you voted in the minority.
You were in the minority.
Okay, that's what I said.